I think it's an ethical imperative that we find ways to get people access to this treatment, and we don't sit there and wait for it to become mainstream, because the level
Mm-hmm.
and magnitude of suffering unnecessarily that's going to occur because of that is just an unbearable thing to imagine. Yes.
And I also think that it's something unethical to
Yes.
wait for that perfect RCT to happen
I
to start to
agree.
implement something like that.
I agree. I think it's
Yeah.
complete. I think that there is a strong enough evidence base that to keep this information from patients and their families waiting for an RCT is an unethical stance. And I say that strongly and with much conviction.
Nicola, welcome to the show. I'm really glad to have you with me today.
I'm so glad to be here. Thank you for asking me.
Our audience may be seeing you for the first time, so could you tell us, please, more about the full scope of the work you do?
Yeah, absolutely. So I'm a licensed mental health counselor in Washington State in the United States. And over the last 8 years, I've been transitioning people onto a ketogenic diet as a treatment for mental illness. My scope of work is mental health counseling in the state of Washington. And outside of Washington, I do personal consultation all over the world, both through individual appointments and then also a very good online program where I can support people using this intervention as a treatment. I also publish case studies in the peer-reviewed literature,
Mhm.
individuals who have had recoveries using ketogenic diets from diagnoses that we would normally consider to be chronic and unrelenting and expect to get worse over the years, but they actually start to flourish and do beautifully. I also teach professional education to psychotherapists, licensed mental health counselors, psychologists on how to support individuals wishing to use a ketogenic diet as a treatment.
So great. But we want to hear about your personal story, your own personal story. How did you end up doing what you are doing today? I know that you are a mental health counselor, so what brought you into this?
Yeah, so I don't really talk about it too much because I feel like that was just a really long time ago where I wasn't doing very well and I needed a ketogenic diet. But I had I had a chronic pain syndrome. And um, after that chronic pain syndrome was fixed or got better, that I was on pain medications, which was appropriate for that chronic pain syndrome, but they had a very hard time getting me off of those medications. I was very physically dependent. And so the different medications that they use to try to titrate me off of those medications did not seem to work for me. I would have all kinds of problems and end up in the hospital. And so I when they finally came up with an experimental protocol that got me off those medications, it came with some very severe cognitive effects. And I had very bad cognitive impairment after that. And I thought I was going to have to retire and not work anymore because I just really, I basically had what would be considered stage one Alzheimer's symptoms. That was my level of impairment, although that was not my diagnosis. And
Mhm.
I was listening to a podcast with Dom D'Agostino, who is a researcher, and he was talking about ketogenic diets for Alzheimer's disease. And I thought, oh, I wonder if that would help me. And so I tried it. It took me a couple months to figure out how to do it because there weren't people really teaching how to do it for neurological conditions. And that in those days it was very much more just for weight loss here in the States. You could find people talking about low carb diets for weight loss, but you really couldn't find anybody talking about the appropriate formulations for people using it for neurological symptoms. But I figured it
Mhm.
out and I felt a profound shift both in how my brain worked very quickly within four days. I remember uh, everybody who benefits from this treatment, not everybody, but many people will say, I felt like the lights came on. And that's very much how I felt. And what I really noticed was these really profound mood effects that happened where I just felt very relaxed and not overwhelmed. and I didn't even realize how hard I was working to regulate my mood before. I had very good skills as a therapist, right? I knew how to regulate my mood, but I don't think I realized that it wasn't supposed to be an effort. It was actually supposed to be a lot easier than what it was. And so when I experienced those mood effects, I thought my patients, my clients really need to have access to this. And then that started me kind of on a journey of figuring out how do I bring this to people within my scope of practice. And here I am today. I figured it out apparently.
Yeah, that's awesome. I believe that anyone who is advocate for keto diet, he must himself have tried it in his own life, and it fixed his own problems.
Yeah,
Yeah, I agree with the mental health effects. I am on it too, and I can witness that it changes life.
it does. Yeah. It's for people who get treatment effects, it's really quite life-changing.
Mhm. Okay, before we dive into the full details, I want to start with something a bit philosophical because what we are witnessing today is honestly strange in the best possible way. Uh, there is a weird, let's call it a weird phenomenon that's happening these days of hundreds of people recovering from serious mental illnesses using these metabolic interventions. And this reminds me of something from the ancient Greek philosophy about Plato, who when he teaches that Suzine phenomena or to save the phenomena, and he meant that anyone when someone witnesses a surprising phenomena or something he doesn't understand happening around him, he should try as a thinker and as a scientist, he should try to build a model that explains this phenomenon and understands it and not to ignore it. This is how science has always moved forward. For example, penicillin was discovered because someone, Alexander Fleming, saved the phenomena of bacteria not growing around certain types of fungi. And we are seeing another phenomenon today that these hundreds of documented recovery stories, many of which you yourself have shared or published, showing people dramatically improving or even fully recovering through ketogenic metabolic therapy. So my first question to you is this: as a clinician and a researcher, how do you make sense of this phenomenon? What on earth is happening in there?
Yeah, well, I'm glad you mentioned that because I really did. That was a profound experience for me. And then, of course, I was also watching some of these stories that people were saying in social media, right? So there's published case studies for many different diagnoses, but there's also a grassroots, we call it here in the state, a grassroots movement of individuals who have recovered from mental illness using ketogenic diets. And so early on I was kind of hearing about that, and so what I actually ended up doing is I made a blog. I made a website called mentalhealthketo.com. And on that blog, I would spend my weekends actually writing articles for that blog. And the way I did it is I thought, okay, I know that we do know some of the mechanisms by which we suspect ketogenic therapy helps heal brains, helps with mental illness, because it comes from the epilepsy world where people have been using it to manage treatment-resistant seizures for over 100 years. So there has been some research into effects of ketogenic diets. And the four things that I really latched onto was from a paper where I think Nick Norwitz was the first author, and I think Shivani Sethi was also an author on that one. And they were talking about these kind of four areas in which ketogenic diets might be very useful for mental illness. And those were oxidative stress, neuroinflammation, neurotransmitter imbalances, these different areas. And so I thought, well, what I'm going to do, I'm going to go through the DSM-5, which is the diagnostic manual that we use to give people diagnoses. And I'm going to look up each of these diagnoses, and I'm going to see if the research literature shows whether neuroinflammation is implicated, whether oxidative stress is implicated, whether these things actually are found in these diagnoses. And to no surprise, they absolutely were. And so we
Mhm.
actually kind of do know quite a bit, not perfectly, like there's really some advanced research going on looking at like the mechanisms that are involved with ketogenic diets, but we do know have some basic info. So um, so that's how I made sense of it. And by writing blog articles that kind of explained this diagnosis has these problems, ketogenic diets treat and have treatment effects for these problems. Why can't we use a ketogenic diet to treat this diagnosis?
Yeah, I've read the book by Chris Palmer, Brain Energy, and he talks a lot about the role of mitochondria in recovery and how keto diet affects mitochondria.
Mm-hmm.
Uh, could you tell could you tell our audience more about that? What does it exactly do to the mitochondria, and does mitochondria only have to do with energy production, or does it have many different other rules inside the
Yeah.
cell?
Yeah. So so mitochondria are basic drivers of metabolism. So maybe some of your listeners have seen these big posters of all these biochemical pathways that are a part of metabolism. And in those pathways, there are, of course, micronutrients and different substrates being made. And mitochondria is really what keeps human metabolism going. And when mitochondria get unhealthy or sick or reduced number or impaired, that will disrupt metabolism. And so mitochondria are much, much more than just the powerhouses of the cells. And they make energy for sure. And that is absolutely crucial. And we can talk kind of more about why adequate energy is so very important in the brain. But they help make your hormones, they help make many substrates, they communicate with one another, they're sensitive to light. They are very much an important part of being a healthy, thriving human being, and you really must mind the health of your mitochondria if you want to thrive, is what I would say.
I got recently interested in the idea of how, when I thought about it, why we humans have two systems of energy, two system of producing energy of glucose and ketones. So, for example, why weren't we just designed to burn ketones or burn the glucose alone? And The phenomenon of having two energy system and only one of them right now in our modern society are used, the glucose system of burning energy. So what do you think about that from an evolutionary perspective? And يعني during ancient times, were we switching between those two systems in a very specific way?
Yeah.
And what was our original design? Yeah, I want to think with this important topic with you.
Yeah. Well, and I think that this is not my area of expertise or anything, but some things seem at least intuitively correct or accurate and make perfect sense. So you have to remember the environment in which we evolved, was very different. So, before, about 10,000, 12,000 years ago, there was the agricultural age, and some areas probably moved to that agricultural age much sooner. But even in the agricultural age, in areas where farming was plenty, we had whole food seasonal carbohydrates, right?
Mhm.
And we did not have a nonstop barrage of high carbohydrate intake of food. And our modern eating environment is such that as people consume very, very high amounts of carbohydrate amounts that would be really difficult to get just through whole foods. But with highly processed foods, we can definitely get that in there. It causes over time insulin resistance. And insulin resistance is a chronic disease state in which it makes it impossible for your body to burn ketones, to access fat stores very well. So insulin is a hormone that is used to push glucose into the cells as an energy source so it can be utilized for energy.
Mhm.
The body does not want a bunch of glucose. The blood levels of glucose, your body works very hard to keep just a teaspoon worth of glucose in your bloodstream at any one time, because more or chronic high blood sugar will cause damage to tissues and organs. So your body
Exactly.
desperately works to keep that under control. And if you have a healthy pancreas and a healthy insulin system and you don't have insulin resistance, having seasonal plenty of carbohydrates, which I'm sure is a benefit or was a benefit to us, in order to put on fat stores for time periods in which that wasn't there, it would be no problem. But in our current eating environment that basically can cause insulin resistance, people cannot go into states of ketosis as they are meant to actually go into. So nutritional
Mm.
ketosis is a normal human state. And there are some researchers who are talking about how it is important for people to be able to get into a state of ketosis, because ketones have network stabilizing properties. So organ stabilizing, neural network stabilizing properties in, different even than the energy source that they can provide. So they're stabilizers. And so if you have chronic high insulin because of the current modern eating environment, and then you can't really get those states where you are in ketosis. And that is part of what is
Mhm.
driving chronic disease. It's part of why we're seeing so many chronic diseases in the research literature show improvement on a ketogenic diet. It's not just mental illness, it's diabetes. It's ulcerative colitis. It's IBS. It's cancer is being treated with ketogenic therapies adjunctively at the very least. So there's all kinds of, polycystic ovarian syndrome. Like I could go on. There's a huge list of chronic illnesses where if you look them up in the research literature, the diagnosis and ketogenic diet, you very likely will see that we see improvements in these chronic illnesses. So I think we were always meant to be in a ketotic state, at least some of the time, and some periods, longer periods of time. And so we've kind of broken that for ourselves.
Yeah, to summarize what you have said, it's like we have these two systems of producing energy, and we are overusing one of them. So the system got worried. We are wearing one system, so that's why we have all of these chronic diseases happening. And the main design or the original design was to switch between those two systems in order to give some one of them rest while you
Yeah.
using the other, and vice versa. And right now we rarely get into ketosis at all. So if I imagine with you, even before agriculture, the caveman,
Mm,
I think we can be sure that if that human being ate some food, it was only one meal per day.
might be. Yeah.
Maybe one I mean one meal per day
Yeah.
at maximum, because there was not that much food available. For if he was hunting, for example, he would be hunting some sort of meat or a keto food. So our bodies didn't change so much from
Right.
this era.
We were
Uh,
able to access our own fat stores for sure. I don't know how often they ate, but who knows? Maybe they had preserved foods that they kind of took with them to some degree. I'm not an anthropologist around that, but they definitely had more metabolic flexibility. They were able to hunt, and that's what we see in different cultures that have not had a modern food environment, is that they are metabolically flexible. They can access their own fat stores for energy. And that's really what we were meant to do. And so insulin resistance as it develops gets in the way of that metabolic flexibility. And I would say, um, poorly controlled glucose or metabolic syndrome, as you know from the Brain Energy book by Chris Palmer, can really affect people's mental health in a very profound way.
Yeah, I think we are putting a model that justifies, that explains this phenomenon, uh, like very well. We don't have to be able to explain it 100%, but I
Yeah.
think we have a good enough model. Um, but I want to ask you something personally. In this field of metabolic psychiatry and metabolic interventions, are there specific questions or specific phenomenon that you are personally struggling with right now in this field? Things that you didn't you don't understand yet. Don't have the model to explain it. What are your own questions in this field right now? What are the things that still you don't have full answer in
Yeah.
it?
Well, yeah, my focus is mostly on clinical practice of using ketogenic diets as a treatment for mental illness. And so there are some questions that we don't have for the use of ketogenic diets with that population at this time. So things I wonder about are much more clinically motivated. So one of those questions is that do people who use a ketogenic diet as a treatment for mental illness, do they have to stay on the diet forever? Because often that's a big concern to people, and they
Many
often won't
many
even,
people ask me that.
yeah, they won't even try it because they think that that might be the answer. And so I'm very curious about that being studied in this population, because what we know from the epilepsy world is that when it's used for seizure control, that people use it between 1 to 5 years. And
Mm.
after that point, their dietitian or their nutritionist and their doctor have a conversation and see about titrating up their carbohydrate intake to see if they get seizures or symptoms. And so it's a very careful consideration. But out of there, about 50% no longer need to do a ketogenic diet, which would suggest that the brain has healed whatever metabolic dysfunction that caused the seizures in the first place has been resolved, because they go off and they have pizza and hamburgers and they eat a normal standard American diet. There is a certain
Mhm.
percentage of individuals, though, that do have to stay on some form of low carbohydrate diet, but often it is not as low of carbs. So we generally use 20 net grams of carbohydrates in diet constructions in general. Bigger people get a little bit more, it's personalized. But sometimes people can move up to 40 to 60, or some people can stay symptom free, on as much as 100 net. But, that isn't in the first 6 months or the first 3 months of them trying to heal their brain with a ketogenic diet. So I'm curious to see what that looks like. I'm also curious. Oh, I'm curious about all kinds of things clinically, right? So I'm also curious about the effects of medications on ketogenic diets. Some of the
Mhm.
medications that the individuals uh, come with, there's like lots of them, 3, 5, 7 psychiatric medications that work by affecting metabolism. And so, what are the effects of adding those to a ketogenic diet? When is the appropriate way and time to titrate? And the safer ways to do that. So here in the States, we really have to be very careful. So for your listeners who are thinking about using a ketogenic diet as a treatment, I want them to understand that there's two parts to it. The first part is mastering the ketogenic diet. And maybe you need to go see a dietitian to do that, and maybe you don't. Lots of people get treatment effects without someone like me helping them. And then the other part is self educating yourself about hyperbolic tapering, because many
Mhm.
prescribers think that they're very, very good at tapering when in fact they are not. There are deprescribing guidelines that have been accepted in other parts of the world for hyperbolic tapering as best practice and not in others. And if a prescriber adjusts someone's medication down too aggressively for them, they can get a recurrence of symptoms that the prescriber then says, "Oh, look, see, you need medication," when really they've been injured. It's a rebound psychosis,
Yeah.
or they're having a
Hmm.
withdrawal syndrong. So there's
Protracted
really these
withdrawal.
two parts. Yeah. So there's these two parts, and so I have questions. I've lots of questions about that because I really find that, we're pretty good at fine tuning their ketogenic diet and getting them into good levels of ketosis, therapeutic levels. The sticky part comes when they need to have their medication adjusted down. And most people, the majority, do need their medication to be adjusted down. Because the amounts that they were on will suddenly become too high for them and they will get side effects. It's called potentiation. And so it's
Hmm.
an important piece of the psychiatric recovery process for individuals using ketogenic diets in this way.
Uh, to give you some of the context here in the Arabic world, I was just making some videos on TikTok just to raise some awareness about tapering medications safely, and like I all like no one ever have ever heard about this type of tapering and what the work of Dr. Yosef was doing, because
Mm-hmm.
I interviewed him on my channel, and people were for the first time this literally this is the first time to hear about this way of tapering and the 10% reductions and all of that. And I got a lot of message of people having protracted withdrawal who because the doctors the one who they trust uh, tapered them so fast from their medications. So
Yeah.
yeah, I believe we really need to a lot of mental health awareness in this field.
Yeah.
From yours, I want to ask you about something from um, uh, dive deep into the topic of the evidence we have for the effectiveness of this intervention. From your perspective, what is the current level of evidence supporting ketogenic metabolic therapy for psychiatric disorders, and where does it realistically stand in the hierarchy of evidence today?
Yeah, there actually is a good evidence base for using ketogenic diets as a treatment for mental illness, and I'm not sure people understand that. So some of the evidence comes from mechanistic studies that came from the epilepsy world. And some of it is clinical trials, some of it is expert opinion, that sort of thing. But I have a slide that I can show you if I can just find it. That kind of shows you about the level of evidence that we're currently at. Oh, here it is. Do you want me to share screen? Is that okay?
Yeah, yeah, perfect. Do it.
Okay, from current slide. Oh, wait, I need to share screen first. From current slide. Okay, there we go.
Mm-hmm.
Okay. So this is a levels of evidence hierarchy, right? And
Okay.
so we're actually at level 2 is happening now. So we actually have all these other levels in place. Some people think of this as an evidence pyramid, right? So the base of
Mm-hmm.
this pyramid is quite robust. So we have lots of evidence from opinion of authorities and reports of experts. We have lots of evidence from single descriptive or qualitative studies. So some of the case studies, for example, that I we kind of help with that. And then level level 5 is evidence from systematic reviews of descriptive and qualitative studies. So we do have a few meta analyses, evidence from well-designed case control or cohort studies. And then level 3 is evidence obtained from well-designed controlled trials without randomization. We are at level 3, right? And
Mm.
everyone wants level 1, which is a perfect RCT that is for a specific single individual disorder. Now, for some people in their mind, they think unless there is evidence that is level 1, a systemic, an RCT that is for that particular diagnosis, that it's something is not evidence based, but that is not the case. And that is not the definition of an evidence based treatment. So this is where we're at. We have multi-site RCTs happening. We have one for schizophrenia in Australia. There's quite a few going on. And if your listeners go to metabolicmind.org and they go to the research section in that website, there's this lovely little map with dots that shows you where all these clinical trials are happening all over the world. And it will also give them an understanding of the research base as it exists now. And it is quite robust. We have, there's a beautiful clinical trial that came out of Stanford on the West Coast here in the United States, Stanford University. And it showed beautiful recoveries in individuals with schizophrenia and bipolar disorder using ketogenic diets in just 4 months. So there absolutely is an evidence base to this. And so it really is important that this information gets disseminated throughout the world. And so I am just feeling deep appreciation for your work in doing this podcast in your region of the world so that people can understand that there is a potential hope in this treatment that just has not been ever realized for these populations.
Yeah, I couldn't agree with you more. And the people of these kinds of severe mental illnesses, and also the families of these people, they are almost are willing to try anything to save their children, you know.
Mm-hmm.
So they even go to some sort of things that are not yeah. To I don't want to get
That
into the
don't have
sensitive
an
area.
evidence base, that don't have a strong
Yeah,
evidence base
some
as a ketogenic
yeah
diet. There's
some
lots of them.
uh,
Yes.
some sort of spirituality and religion interventions that are not proven scientifically by any sort of evidence. So when we give them something as strong as this, I see no reason why they shouldn't give it a try, give it a go.
Yeah.
And I also think that it is ethically it is ethically not correct. It's something unethical to
Yes.
wait for that perfect RCT to happen
I
to start to
agree.
implement something like that.
I agree. I think it's
Yeah.
complete. I think that there is a strong enough evidence base that to keep this information from patients and their families waiting for an RCT is an unethical stance. And I say that strongly and with much conviction. And I do actually know a few psychiatrists who have that stance. And I will tell you what happens when the people, their patients learn about this as a treatment and they go to that psychiatrist and they say, "Why didn't you tell me?" And that psychiatrist say, "Well, there wasn't an RCT." That family and that patient no longer trust that practitioner and they no longer trust the field of psychiatry as much as they once did. And so I
Mhm.
would say the field of psychiatry is doing damage to its own field in
Yeah.
in their stance around this. Um, Lots of people talk about how psychiatry uses many medications in mixtures that are not validated through RCT, and yet they give those to
Mhm.
patients without blinking an eye, right?
Exactly.
So there, there is going to be collateral damage to the psychiatry field for keeping this from patients. And so we'll just have to see how that unfolds.
Yeah, I agree with you. And if we could make the analogy of the time of COVID, for example, in 2020, I don't think any sane person would wait for the perfect study of safety and the perfect RCT to be made about the vaccine in order to start taking it when someone in front of him is could die of
Yeah.
that disease or that virus. And we are dealing with a population that in very high risk of suicidality.
Yes.
So
Yes.
So I
So yeah, this population is at risk of losing their life or their quality of life for decades. So there's a high risk of suicide in many of these diagnoses, bipolar disorder, anorexia, for example. And then also these individuals who are on these psychiatric medications that impair metabolism die 10, 20 years earlier. Their lifespan is literally cut short. And if you ask any of them that are highly medicated, they will tell you that their quality of life is almost unbearable on their
Mhm.
psychiatric medications. They feel truly estranged from their sense of self. They do not feel themselves. They do not feel good. They do not have energy. Their quality of life is very low. And so anyone who is listening that thinks, gosh, I better not tell these patients about this option until there's a perfect RCT. Please understand that there is incredible suffering going on that could be alleviated in less than 4 months for them, and that there really is a cost to not sharing this information that's in the research literature about this treatment.
Yeah, this is the message that clinicians and psychiatrists need to hear. What do you think needs to happen for metabolic psychiatry to become mainstream?
Well, I think it's inevitable that it's going to become mainstream. At least, oh no, 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 my dear. It's gonna
After
it's
after
a
after some
it's a
year, after
tidal
some year,
wave.
after many how many years? I'm
After
just
how many
questioning the
years?
years.
Well, here in the US, it is much more popular and understood and known about. There's really great things happening here. Part of that is because there is a foundation called Bazooki Group that is
Mhm.
funding a lot of the studies at these different um, universities to do this type of work. So that's getting done. So part of the issue was that there was nobody to fund these studies because there wasn't a profit to be made in diet and lifestyle and having people recover, right? And so usually those studies are done by
Exactly.
pharmaceutical companies that have the budget to do that. So we're having the science is being funded. There's going to be an undeniable research base to suggest this. Now, the individuals who see people recover using ketogenic diets, they cannot unsee it. Whether they are a psychiatrist, a nurse practitioner, a family member, a boss, a loved one, a spouse, they cannot unsee the type of kind of transformation that some of these people are having, the recovery. And so once you see someone recover like that, you would like that for yourself. And so you will go into the hospitals and you will go into the clinics and you will go into the psychiatric offices and you will ask for this treatment. And
Hmm.
either psychiatry is going to figure out that they're going to have to provide access to this treatment and be part of what's happening in this movement, or they're not going to, and people are going to move right around it and still get help because that's part of what I do. So when you asked, what are all the things I do? I actually forgot a really important one, which is um, I have a nonprofit in which I provide education and support for individuals who are wanting to learn about ketogenic metabolic therapy, and so that they
Okay.
can access the treatment with the help of a prescriber managing medications and a treatment team, so that we don't have to wait necessarily for this to become mainstream and for this to become standard of practice. I would say, because I enjoy talking about ethics, and I can tell you do too. I think it's an ethical imperative that we find ways to get people access to this treatment, and we don't sit there and wait for it to become mainstream, because the level
Mhm.
and magnitude of suffering unnecessarily that's going to occur because of that is just an unbearable thing to imagine. Yes. And so
Exactly. I agree with
so
you.
yeah, so people are going to find this. Now, in America, part of what's making this so accessible and so understood is there's this wonderful foundation called Metabolic Mind. I've mentioned it
Mhm.
earlier in the podcast, metabolicmind.org. And on there, are lots of people sharing their stories of recovery using metabolic therapies like the ketogenic diet. And they do lots of informational, science-based, research-based videos about all the questions around it as a treatment. And so it would be great if you had one for your region, you know what I mean, that was providing that service to
Yeah, this
individuals
is what I
about.
am trying to do.
Oh my goodness, that would be wonderful. Yes. So that really helps to have that pop up on someone's YouTube channel in the morning, right? And for them to be like, "Oh, what is this?" And then they start to explore and they explore the possibilities through that. And so it's if we can't educate the psychiatrist fast enough, I think we just really need to educate the population that needs it.
Yeah, exactly, exactly. Yeah, I believe that maybe in just 3 to 5 years, the whole landscape will be different.
Yeah.
This is my own conviction.
Yes.
Okay, this is so promising. Um, let's dive into uh, a clinical part from your own clinical experience. Um, I want you to tell us how you deal with patients with severe mental illness in your clinic in general. For example, if a patient diagnosed with bipolar or schizophrenia enters your office, uh, usually they are on a cocktail of different psychiatric meds. How do you usually handle their case, and walk us through what typically happens with such patients?
Yeah.
How the medications usually tapered? Yeah, tell us
Yeah,
the whole process.
I'll tell you what it looks like. So first of all, I don't have an office. This is my living room, and I do tele visits with people, which
Okay.
makes me accessible to people all over the world. Some even from your region have contacted me and worked with me. Um, so yes. And what that looks like is sometimes that individual comes to the Zoom meeting or the session on their own. Sometimes they have a support person. There is great variability in functioning in this population. So you can get someone with a serious mental illness, mental health diagnosis who's quite functioning and able to do this on their own. And then you have people who are not or are on has such medication side effects they can't function. And in that case, we have a support person sometimes. And then sometimes I will tell you, I will get someone on a call with me and I will think, oh my goodness, I don't know if this person is going to be able to do this. They are in such bad shape and they will surprise me. They will
Mm,
surprise me. So I never anymore put it past anybody to be able to do this intervention just fine. They really, the people you think who couldn't do it, they actually do beautifully often. And then what we do is I look at I have a degree in a postgraduate certificate in nutrition and integrative health. So I'm very interested in what does your diet currently look like? What nutrients are you possibly not doing well in coming into your ketogenic diet? We talk about supplementation. We talk about beginning baseline blood work. And then I have them begin to track their food using an app called Chronometer. And I just
mhm.
like to see what they eat. I just like to see what level of carbohydrate their body is expecting. I like to see the nutrient composition of their diet. Is it more bioavailable forms of micronutrients? Are they relying on less bioavailable forms? And then after I get the data back of about a week's worth of tracking or so, then we do macros, but often I will transition people down in their carbohydrates over 2 to 4 weeks. And I do that because when you transition someone a little bit more slowly, they're less likely to get some of the initial side effects of a ketogenic diet that are uncomfortable, like electrolyte imbalances, for example. And also, it gives them a chance to find new things to eat, right? And get used to how their plate is going to look different. And it increases the likelihood that they'll start their ketogenic diet and be able to kind of stay on it without being like, oh, I ran out of low carb foods and I don't know what to eat. I'll just eat this mango or whatever, right? So it really
Mhm.
helps that a great deal. And then we get them into ketosis, and I have them continue to monitor their diet because I might need to adjust their macros appropriately, and we try to get their ketones into a therapeutic, somewhat sustained level. And then we just get out of the way and we let the ketogenic diet do what it's going to do. And you give them support, encouragement while they are on the diet, and help them troubleshoot any issues that come up. And that's basically what I do. And, sometimes my life coaching skills are helpful in my work with people. But yeah, that's what it looks like. Oh, you were asking about
Amazing.
medications. Yes. So I don't touch medications, and I don't talk
Mm-hmm.
about medications because I'm a non-prescriber. So before someone gets to work with me, they have to have a prescriber on their treatment team. I tell people to put together a treatment team. You can have me or another dietitian. You can have a psychiatrist or prescriber. Sometimes that's a general practitioner doctor that's managing their medications. And if they would like a psychotherapist or a psychologist to additionally be extra support on the team, they can be really lovely to have. And the psychiatrist does not have to be a perfectly ketogenic metabolic psychiatrist. They do not have to be perfectly informed. They do have to
Yeah,
be
yeah.
open to the understanding that they may need to adjust meds and agree to that. They need
Hmm.
to agree to medically monitor the diet. Many of them don't know how to do that. So a lot of my work is teaching people how to self-advocate for themselves with their prescribers and their medical personnel to ask for the things they need to monitor the diet. And then, just like I spoke about earlier in this very podcast, I really encourage them or their support person to take a hyperbolic tapering course or get knowledge about that before they have these conversations with their prescribers.
Mm-hmm. Perfect. Um, about one last topic that I want to open and end our discussion with, how to build a movement powerful enough to walk against a culture that rotates around eating carbs. And could what happened to cigarettes in the 90s happen to fast food and carbs uh, in our era? Could it
Yeah.
could the history repeat itself?
Yeah, I think it definitely could. So, here in the United States right now, there's a movement that is coming from the government actually against ultra processed foods, and in good, it's about time, quite frankly. Ultra processed foods, and these are not the whole foods we're talking about, right? These are the things down the aisles of the grocery store that come in packages with many, many ingredients, and they're really substances. They're not really food. And they're substances because they're designed by the same executives that used to work in the tobacco industry. They moved into the food industry, and they have worked with
Mm-hmm.
scientists to have the most perfect ratios of fat and salt and sweet in such a way that it actually really does change brain chemistry. They really do act like substances in the brain, and they are not nutrition, because when you have a highly ultra processed food diet, or many of your calories, percentage of your calories come from those, they are actually more nutrient depleting than adding. So high carbohydrate diets reduce micronutrient stores of things like thiamine and magnesium, for example. And so they're just really not food. And so there really needs to be a conversation about what is food, right? Does this nourish me, or do I use this like a drug to regulate my emotions? Um, and so there needs to be more conversation about that. But yes, I think there absolutely will be. There is a big research base about the harm that these food products cause to people. And I think there's a lot of business industries that are pushing really hard. Back then it was just the tobacco industry, right? And there
Mm-hmm.
was a few big players that were really pushing against any change around their products. But I think that there's really a lot of highly processed food manufacturers all over the world. But I am optimistic. I think that when people understand what is in the way of their healing, the people I work with, like you said, they will do anything. They come to me, they're like, Nicole, just tell me what to do, right? They really, if they understand that these products are substances that get in the way of their thriving and their healing, they will give them up happily. They do all the time, the
Yeah.
people I work with. So, and I think that once they kind of understand that those food companies really do not care about them, really do not have any interest in whether they get to live their very best life possible, whether they're happy. They don't care about you as an individual. They're after your money. And once you kind of understand that, I think that it becomes an unfulfilling relationship with the Doritos packet or the Krispy Kreme donuts, and you are much better able to put those aside.
Yeah, I agree with you. Uh, Finally, if you would leave one final message for our audience, what would it be?
Don't be constrained by what you think is available in your region. This intervention is accessible to people all over the world, and they have you and they have other people like you that they can seek out and find to assist them. More and more people are getting trained in how to help people implement the diet for this purpose. More and more psychiatrists are being trained. For example, we in the US we have free continuing medical education courses that doctors can take to help educate them about ketogenic diets. It's just a matter of um, it's a matter of you guys developing that over there in a way that works for their professional education there, and to have hope, and do not let anyone or anything get in the way of your healing. And if you want access to this, you'll find a way to get it. Don't give up.
Thanks, Nicola, for being with us today. We really appreciate it, and thanks for your precious time.
Yeah, thank you for having me.